that affects millions of people around the world, especially in Africa and sub-Saharan Africa. Joining me today is Dr. Henry to break down this topic of sickle cell disease. Welcome, Dr. Henry.
Thank you very much, Dr. Kamala. Thank you for that kind introduction. I'm happy to be here to talk about a topic that I'm very passionate about, of sickle cell disease, because I know it's such a big problem in our setting, and I hope our viewers will enjoy our show.
Yes, it affects mostly Africans. So let's start by breaking this down. So what is sickle cell disease, and how is it passed on, or how is it inherited?
Thank you very much, Dr. Kamara. So sickle cell is actually the commonest inherited blood disorder. So there are quite a number of blood disorders. People must have heard about things like leukemia, thalassemias. Some of them you might not have heard about them. But sickle cell is the commonest inherited blood disorder. And as you hear the name, we actually get the name sickle from the shape of the cells. So in our bodies, we have cells which we call the red blood cells. These are cells that transport oxygen in the body. And under normal circumstances, these cells they are circular, okay, with a center, and they have a pigment called hemoglobin. So these are the cells that move oxygen throughout the body. However, in sickle cell, instead of these cells being round-shaped, for them they adopt a sickle shape. I don't know if our viewers have seen a sickle. Back in the days when we were in the village, you used to cut grass with a sickle. It's more like a shape of a moon, half moon. Yeah. So in people who have a sickle cell disease, their cells, instead of being round, for them their cells are actually sickled, and it's inherited. So parents can pass on to their children. So its pattern of inheritance is one that if two parents have this allele, or the parents whom we call carriers, okay, someone can actually be a carrier when they really look normal, they don't have any symptoms, but they have a gene for sickle cell disease. So if two parents who are carriers marry each other, they have a chance, about 25% chance, that one of their children could end up with sickle cell. So it's that condition characterized by having cells that are sickled, and these cells, they have quite a number of problems that you're going to see later on. But before going into that, I want us to know that it's a very, very big problem, and currently it's one of the biggest problems, especially in countries like sub-Saharan Africa. As current statistics put it, 75% of all people who have sickle cell disease are here in sub-Saharan Africa, and globally there are close to 300,000 people that are born with sickle cell every year. And in our setting here in Uganda, 50 to 20,000 babies are born every year with sickle cell. So it's such a big problem in our setting.
Yes. So sickle cell disease is a genetic disease. Its cause is genetic, meaning that you have I could call it a defect on the gene. We call it a mutation on the gene that causes you to produce red blood cells that have a tendency to change shape when they have a tendency to change shape, and that causes the disease. As we shall go deeper into the science of the abnormal shape of the cells and how it causes the pain, but that is the basis of the disease. And some people are carriers of this gene. So it's called, it's what we call a recessive trait.
Yes.
Meaning that you have some carriers who do not show any signs of the disease. They do not feel sick. They don't actually get the symptoms of sickle cell disease. But then those who get two defective genes, one from either parent, they end up with the disease.
Basically, areas which have too much malaria usually tend to have so much of this sickle cell disease. I've happened to be in some places where they are very cold and they don't have malaria as much, and also the sickle cell is not as much, compared to when you go to places where malaria is so much and sickle cell is so much. So there is sort of a correlation between these two conditions.
Yes, because we know that most of it's more predominant among Africans and people of African descent. Yes, so I was about to ask you, though now you've explained already, I was about to ask you why is it more prevalent in Africans and people of African descent. So we may understand that it's because of the fact that this trait has a protective effect against malaria. So evolutionary wise, the people that carry this trait would the people that carry this trait would survive more in the malaria endemic areas.
Because seemingly as the mosquitoes try to suck this blood, so people have a trait, seemingly they are protected in a way, and that's how it happens that places that have too much malaria, usually the sickle cell trait is quite a lot. However, people should also notice a difference, that there is a difference between the carrier as well as a patient who has sickle cell disease. So a carrier is going to be a normal person. Normal, they do their business. Normally, they don't have any sickle cell symptoms because they have a dominant gene that covers or suppresses this sickle cell gene, which is recessive. However, these parents, if two of them get to marry, so because of those genes, the way they mix up, there's a 25% chance that one of their children would have a sickle cell disease. And by saying 25, it doesn't mean that, if they're going to produce 4 children, one of them, by chance, it's even possible that you can produce 3 children, and all of them have sickle cell disease, simply because most of these changes happen by chance. Yes.
So you might be a carrier, or you might have the disease. And if you're a carrier, you may show no symptoms at all. The only indication you may have that you may get the disease actually, you may notice maybe that you don't fall sick with malaria as often as other people. So I know someone who is like that, who discovered that she was a carrier in that way, because she realized that she does not get malaria as much as other people. So she asked her parents, and she realized that they had that trait, and so she was a carrier. So now let's go a bit into the science of sickle cell disease. So what causes those painful crises? We call them painful crises. The times when they come down with a lot of pain in one part, maybe in the limbs, or in the back, or in the chest. So what causes that?
Awesome. Very good question. So, like we said, that these cells are not the usual cells. Of course, for the normal cells, for them they are a bit flexible. So as
the normal red blood cells.
The normal red blood cells, they are flexible. So as they move in the blood vessels, taking their blood, taking their the nutrients and oxygen, they are flexible. They can squeeze within small vessels and they pass through very well. So when they deliver oxygen, they release the oxygen to the tissues, and then these cells go back and pick more oxygen. Of course, they carry carbon dioxide back to the lungs. So that's what happens in a normal person. However, people who have sickle cell disease, unfortunately, 1, their cells, the shape is deformed, and 2, their cells are not as flexible. So for them, their cells are quite rigid. In that, as they go and they give this oxygen to the tissues, the moment they get into these places where they don't have oxygen, or in any places where the oxygen levels are lower, these cells they sickle, they become more rigid, and they block off some of these small blood vessels. So the moment you block off any blood vessels, be it any part of the body, there will be some consequences. So that explains what happens in some of the things like vaso-occlusive crisis, is that you're going to have these small micro vessels being blocked off by these cells. Actually, these cells also tend to clamp together. So when they do clamp together, they block off these blood vessels, and that's going to result into the tissues that are supposed to be supplied oxygen and nutrients by this blood vessel to undergo some death, of course, because they cannot get the nutrients. So because of this necrosis, people are going to get intense pain. So if it happens, for instance, in the bones, you're going to get very, very bad pains, and this could happen in any part of the body. It could be the bones, it could be in the brain, it could be any part of the body. And also this explains why sicklers have an increased risk of getting strokes, because in stroke, you're going to have a part of the body or the brain that is no longer receiving the nutrients, simply because it's blocked off. So sicklers have an increased tendency of getting complications like kidney problems. There's a condition called sickle cell nephropathies, and any other part of the body could actually be blocked off by these sickled cells, resulting into intense pain. So this explains the vaso-occlusive crisis that we see with these patients.
This can happen anywhere in your body.
Yes.
It can be in your lungs, it can be in your muscles, it can be in your liver, and so oftentimes they have low hemoglobin levels. They are anemic. So what brings this about?
For starters, like we've said, the cells are not the normal cells. The cells are abnormal. That alone itself could explain why the hemoglobin is going to be low, because if the cell is sickle, it will have much less hemoglobin. But on top of that, these cells which are sickled, they have a shorter lifespan. So realize that our normal cells usually will spend about 4 months, about 90 days to 120 days. But patients who have sickle cell, because the cells are abnormal, the body's filtration system, because the system has the body has a system that helps it filter out all the abnormal cells. So the body's system filters them very fast and at a very high rate, and this results into these cells having a much lower lifespan. So because of this, they are broken down very fast, and as they are broken down, the patients will actually be anemic, simply because most of the cells that are supposed to be carrying the oxygen are being destroyed. So they tend to have these anemias, and apart from that, usually after breaking these cells, the pigment that is formed after you've broken down the hemoglobin, it forms a yellow pigment. It's called bilirubin. This pigment is yellow. So this pigment is also going to be too much in their blood, and this explains why most of these patients, they will tend to have yellow discoloration of the eyes, simply because there's this pigment that is produced after their cells are being broken very fast. So the point is, their cells have a shorter lifespan, they're broken very fast because they're abnormal, and on top of that, that pigment that is produced, called bilirubin, is what gives them that yellowish color that can be seen from the eyes.
Okay, so we've looked at what sickle cell disease is and the science behind the disease. We're going to take a short break, and then we'll be back to look into how you can tell that you have sickle cell disease, how to diagnose sickle cell disease, and what's the treatment that you get when you have sickle cell disease. Thank you for watching, and stay with us at the DOCtalk show.
You are watching the DOCtalk show. This message is from the Ministry of Health with support from partners.
Hello, Kampala, Uganda. In response to the national call of strengthening the traffic security, Good Products Group HGO brand has officially launched the Rider Selection Campaign. Registration is now open. Visit www.riders.hgo.com. Complete your registration now for a chance to win exciting prizes, including motorcycles, exclusive HGO gift boxes, and official rider vests, all while promoting safe riding awareness. This is how to participate. Pay the registration fee, invite 3 friends to form a team of 4, and your registration fee will instantly be refunded. Begin your journey of honor today. Don't miss this opportunity. Join the challenge, promote road safety, and become a pioneer rider. For details, visit the official Good Products website at www.hgo.com or call toll-free 0800-335-555 or visit our offices at Kingdom Kampala 3rd floor to register now and win prizes worth millions.
The Prime Minister of Uganda, Honorable Robina Nabbanja, invites the general public to her Thanksgiving ceremony to honor God for the gift of life and leadership. At the same event, we shall thank His Excellency President Yoweri Kaguta Museveni for his visionary leadership and mentorship. This function will take place on 21st June 2025 at Mpasana Town Council Playground, Kakumiro District, starting with Mass at 10 a.m. The chief guest will be His Excellency General Yoweri Kaguta Museveni. Your presence will be greatly appreciated.
Looking for instant excitement? The Uganda National Lottery Spin for Cash game is now available online. Wherever you are, you can join the excitement for just 500, 1,000 and 2,000 Uganda shillings. Don't miss out. Register now on www.nationallottery.go.ug for a chance to win your share of 2 billion instantly. What are you waiting for? Play Spin for Cash now, anytime, anywhere. Ituba is the proud operator of the Uganda National Lottery.
Uganda National Lottery. Dream, play, win.
Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Ituba Uganda and regulated by the National Lotteries and Gaming Regulatory Board.
You are watching the DOCtalk show. This message is from the Ministry of Health with support from partners.
So, Dr. Henry,
Yes.
what are the symptoms of sickle cell disease, and how do they diagnose sickle cell disease?
Okay, thank you very much for that question. Now, sickle cell has quite a number of symptoms. One of the questions I usually find is that when do these symptoms begin? And the answer to that is that usually these symptoms don't start in the early childhood, early infant period, simply because there's another type of hemoglobin. It's called fetal hemoglobin, the hemoglobin of the fetus. For it, it has an advantage in that it doesn't sickle like this other hemoglobin that patients with sickle cell disease have. So during this early period, when that fetal hemoglobin level is still high, they don't have any symptoms. So most of our patients' symptoms actually start as early as 9 months. However, there are those who actually don't have symptoms until a little later in the adult life. So some of the common symptoms, like you mentioned, there are those painful crises. The patients will present with very, very severe pain. Sometimes it can be in just one body part, sometimes it can be generalized. They will present with anemia. Usually patients with anemia will tend to feel dizzy, they sometimes get headaches, they could come in with their hearts beating very fast, what you call palpitations. I already talked about the yellow discoloration of membranes, simply because these patients cannot have these nutrients and oxygen delivered on time. Sometimes they will get delayed growth, so they could actually present in with delayed achievement of milestones. Some of them actually get complications. Some of them would get stroke. They could come to when they seem like they are lame. Maybe one of the parts of their body is not working. It could be a hand, it could be a leg, it could be any part of the body. Some of them will present with other complications, like those who have their kidneys affected. They will come with symptoms. So because it's multi-systemic, it can affect any system. But most importantly, what usually shows us the signal is those painful crises, as well as the anemia, as well as the jaundice, that is the yellow discoloration of the mucous membranes.
Yes. So how is the diagnosis made? So if I maybe want to find out whether I have sickle cell disease or not, or if someone has a child and they want to find out whether this child has sickle cell disease or not.
Okay. So the process of making the diagnosis for people to know that actually this is a condition, of course it's a process. It's not a one-step thing. It starts with history taking. So your health worker will take a detailed history. They'll find out what are symptoms, how have they been coming. They'll examine the baby. Okay, they will check for those symptoms of anemia, those yellow discoloration of membranes. They will check for any complications. So before we make any tests, usually we start from that. Then after that, of course, in the mind of a doctor, they will be able to figure out that most likely this it is. And so one of the tests that is mostly definitive for diagnosing this condition is called hemoglobin electrophoresis. So in this test, they get off a blood sample from the baby, they take it to a machine, which is called the hemoglobin electrophoresis machine, and then this machine is going to separate his hemoglobin. Remember, this person has some abnormal hemoglobin, that's actually called hemoglobin S. Normal individuals have hemoglobin S, so there are different types of hemoglobin. Now, this machine is going to separate and give you the percentages of how much of this hemoglobin this person has. A normal person who doesn't have sickle cell, they will present with 100% hemoglobin A, simply because that's normal hemoglobin and they're okay. Carriers will have less of that, but they'll have some component of the hemoglobin S, which people with sickle cell disease have. Then when you come to patients who have sickle cell disease, for them they're going to have a significant level of this abnormal hemoglobin S. So just look at these percentages, of course, with all the clinical information that you've gathered from the history and examination, and then you can make a diagnosis of sickle cell disease.
Okay, so the diagnosis is made using hemoglobin electrophoresis.
Yes.
So is that available?
We have machines actually around, and I got to learn recently that even the national referral currently, some of these services are provided at no cost. So the machines are there, the services are there, and they're accessible, and we encourage our people to make use of the services.
So now, when we are diagnosed with sickle cell disease, or for people living with sickle cell disease, we know that their lives are full of hospital visits, being on medication and all that. So what is the treatment for sickle cell disease?
Thank you very much for that. Now, patients who have sickle cell disease, after you've confirmed the diagnosis, it would be nice that you enroll into a clinic, a sickle cell clinic. These ones are available in most of the regional referrals, and even some of the district hospitals now they have sickle cell clinics. So it would be good that you enroll into such a clinic. So in these clinics, you always do periodic visits. Sometimes they will review you after a month, sometimes after after 2 months, sometimes after 3 months. And with these visits, they will always check and see how the disease progression has been, and they can always advise accordingly. And then, if patients come in a crisis, or when they are having those first vaso-occlusive crises, or they're having a complication, we always attend to those first. Many times, the patients are going to come in when they are anemic, they don't have blood, or they're having a crisis. So we always start by attending to those. Sometimes they will need a blood transfusion. Sometimes they need to be on painkillers, and sometimes it's actually strong painkillers. And then if they come in with an infection, we also manage the infection. So we usually assess our patients comprehensively and attend to them in that way. However, there are also things that we do, or there are medications that we give to try and reduce on these vaso-occlusive crises. I'm aware our patients who are on SICKLE, who are having this condition, you must have heard about a drug called hydroxyurea. So this is one of the drugs that increases the other hemoglobin, fetal hemoglobin, that reduces on this sickling. So patients who have been on hydroxyurea for some good time, and they are adhering to their treatment, their vaso-occlusive crisis, their need for blood transfusion drops markedly, and that's why we encourage you. Actually, the current guidelines have it that for any patient with a diagnosis of sickle cell disease, they should be on hydroxyurea because it reduces on these vaso-occlusive crises, reduces on the transfusion needs, as well as the hospitalization. So apart from the hydroxyurea, there are also drugs like folic acid. This one is helpful in helping to rebuild, the cells. It's one of the raw materials for making the cells, so we allow patients to be on it. Then they also be on a drug for malaria prophylaxis. As much as sickle cell carrier has some protective effect on malaria, patients with sickle cell disease can actually get malaria. Okay, so we also will be on a treatment for malaria prophylaxis, as well as there's some vaccination which is quite good for sickle cell disease patients. So the vaccines that we give them to prevent them from acquiring some diseases.
Yes, like you mentioned, it's good you mentioned that the carriers have some protection against malaria, but the people with the actual disease actually can get malaria, and when they do get it, they can get serious complications, even more so than the person that doesn't have sickle cell disease. And then also there have been some advancements in sickle cell treatment. I hear of exchange transfusion. Yes, could you throw some more light on that?
Yes. Quite a number of advancements have come up in sickle cell disease. You've mentioned about exchange transfusion. There are patients whereby we can actually reduce on the burden or on the sickle cells, sickle cells that they have, and then we replace them with normal cells. So
how does it? So it works by replacing. It's like they're taking the blood full of a significant portion of the blood containing the abnormal cells, and transfusing blood that has normal red blood cells.
With technology, it's now possible to go and find that gene, and they alter it, they change it. Instead of being a sickle cell gene, they can actually alter it to become like for a normal person. So the moment it's done, it's actually providing ultimate cure for sickle cell disease. Currently, this intervention is being done in some places like the United Kingdom, just that it's very expensive, and also maybe lastly, things like bone marrow transplant. We know that these cells are producing the bone marrow. So patients with sickle cell disease can actually undergo bone marrow transplant, resulting into formation of cells that are actually normal. Though some of these are very, very expensive interventions, some of them are quite invasive, but they're providing ultimate cure for sickle cell disease.
Yes, so it's interesting the advancements that are being made. Yes, I personally sometimes follow them, and which would be good if we could eventually have some of those advancements here, where sickle cell is more predominant. So we are still shedding light on sickle cell disease in honor of World Sickle Cell Day on 19th of June. We are going to go for a short break now, and we'll come back. Thank you for watching, and stay tuned on the DOCtalk show.
You are watching the DOCtalk show. This message is from the Ministry of Health with support from partners.
All eyes on Abidjan for the 16th General Assembly of the African Union of Broadcasting AUB. At the heart of the discussions, Africa's leading voices in broadcasting and media. Theme: Empowering African Media, Strategies for Financial Resilience, Technological Growth and Content Innovation. Abidjan will also host the Grand Night of the AUB Media Awards 2025.
Let yourself be captivated by Côte d'Ivoire, the legendary stadiums, the golden beaches of Assinia, the majestic Basilica of Yamoussoukro, and of course, the unforgettable taste of achaka with grilled fish and the irresistible Kajeno chicken. Where media meets a vibrant Africa. See you soon in Côte d'Ivoire.
Hello, Kampala, Uganda. In response to the national call of strengthening the traffic security, Good Products Group HGO brand has officially launched the Rider Selection Campaign. Registration is now open. Visit www.riders.hgo.com. Complete your registration now for a chance to win exciting prizes including motorcycles, exclusive HGO gift boxes, and official rider vests, all while promoting safe riding awareness. This is how to participate. Pay the registration fee, invite 3 friends to form a team of 4, and your registration fee will instantly be refunded. Begin your journey of honor today. Don't miss this opportunity. Join the challenge, promote road safety, and become a pioneer rider. For details, visit the official Good Products website at www.hgo.com or call toll free 0800-335-555 or visit our offices at Kingdom Kampala 3rd floor to register now and win prizes worth millions.
The Prime Minister of Uganda, Honorable Robin Nabanja, invites the general public to her Thanksgiving ceremony to honor God for the gift of life and leadership. At the same event, we shall thank His Excellency President Yoweri Kaguta Museveni for his visionary leadership and mentorship. This function will take place on 21st June 2025 at Mpasana Town Council Playground, Kakumiro District, starting with Mass at 10 a.m. The chief guest will be His Excellency General Yoweri Kaguta Museveni. Your presence will be greatly appreciated.
This isn't just a girl. She is the future. This is a teacher, a doctor, a community leader, our future president.
Their support meant so much to me. And as a teenage girl, I stayed focused and was protected from child marriage and teenage pregnancy. I will support other girls against child marriage and teenage pregnancy.
Take action. Report any case of defilement or child marriage to the police or call Sawuti 116.
It's a FlexiPay cashback explosion. Shop and pay with your FlexiPay. Cashback instant. It's a FlexiPay cashback explosion.
It's a FlexiPay cashback explosion. Simply shop and pay with your FlexiPay at activating outlets and enjoy instant cashbacks. Terms and conditions apply. Stanbic Bank is regulated by the Bank of Uganda, and customer deposits are protected by the Deposit Protection Fund up to 10 million Uganda shillings.
Welcome back to the DOCtalk show. My name is Dr. Kamala Ivan. This show is sponsored by the Ministry of Health and Kamala Men's Collection. So, in this episode, we are talking about sickle cell disease. Now, sickle cell disease is not only a story about pain, it's also a story about resilience. So before we go into looking at the treatment and diagnosis, we are going to hear a story from one of our sickle cell warriors, a person living with sickle cell disease.
Way back in 2013, when I was heading the HIV for children born to HIV-positive mothers, by then, our minister was the Director General at the Ministry of Health. And through her guidance and inspiration, we used our HIV work that we are doing then to do a survey to understand the burden of sickle cell disease. And when the results came out of all the regions in Uganda, the results showed that Lango region bears the greatest brunt of this problem. It doesn't have to be very sophisticated that you have to do. Because sickle cell is not only a health problem, it is a social problem. It touches so many spheres of life. It is an economic problem as well. Let us raise to the occasion. The theme this year is to donate blood. This is a global theme by the World Health Organization, because 30% of blood consumption is by the sickle cell warriors, SICKLEs. And blood can never be bought, can never be manufactured anywhere. Every one of us, we have blood. And that blood can save a life. So I'm just appealing to us to become more selfless, to see that we help the SICKLEs, but also to encourage the warriors that we are doing a lot. As I speak today, Uganda is one country in the whole of sub-Saharan Africa that has mapped the burden of sickle cell across the entire country. Uganda is the only country in sub-Saharan Africa that has sickle cell programming at the national level. Uganda is the only country in sub-Saharan Africa that has initiated nationwide newborn screening. So we are a model. People look to us. People want our inspiration. But let every one of us determine to be a champion in the fight against sickle cell disease. Every one of us. You can do something, whether you are a health worker, whether you are a community worker, whether you are a political leader, whether you are a religious leader, a cultural leader, you are a common person in the society, you can pass on the message. Now we have social media, politics and soccer on social media. We can use the same platforms to pass a message about sickle cell disease. The greatest champion for sickle cell in this country is our minister. If there is anything we can do about sickle cell, there is no better time but when she's still in charge. You people from Lango region, you have an unprecedented opportunity that you have a champion who is your own child. As she's fighting for all other things, I know she will spare no energy to turn the tide of sickle cell in this region. Let us use the opportunity. As she's still in charge, that sickle cell becomes history. Ceases to be a scourge that is killing our people.
The launch of the new revised national sickle cell guidelines are very important in our today life of how we monitor the sickle cell patients. The record, for example, the newborn register, it's going to guide us to know the statistics of the newborn children in Uganda. Previously, we've been having the high level of the children dying. Every year we lose 25,000. So we want to see, is there any change? Has this reduced or it has increased? So it will be guiding us. As the civil society organizations, it is a mileage for us.
Before I share my story, I want to turn back to Honorable Minister. I think God has brought me here for a purpose. I've been praying for you and celebrating you for the last 22 years that I've been in this fight. I first came to Lira in the early 2000s, and Honorable Minister was the medical superintendent of the hospital in Lira. But then when I wrote to her that we were coming to see whether there are sickle cell families here, it took her just 1 week to mobilize 500 families. I'll never forget that, and I always thank you. And she started a clinic after that day. I have sickle cell disease, and I was seen at the age of 6 months. I was born in a family of 4. At that time, they told my parents to break away because they were not going to have a normal child. I was their firstborn. But my father decided that he stays together so that they raised me well and I die a happy baby. Fortunately, they had 3 more and they don't have sickle cell disease. As I speak today, both my parents passed on. They educated me up to Makerere University. I graduated as a secondary school teacher, but I dedicated my life to teach about sickle cell disease. So I never went to the schools, and I have done that for 22 years. I got married in 2003, So I have been married for 22 years. And in this marriage, I got 3 children. My firstborn is 20 years. She's going to university. She's followed by a 12-year who is in P6, and our baby is in P1. So, to my fellow warriors, today the services are better than what we had when we were young. Just make sure you follow the appointments, you follow the instructions, and eat well. Go and study, do something. The sky will be the limit. So I have been working in Sickle Cell Association for those years I've said. My husband has been a lay reader for the years we've been together. So I also work in Church of Uganda, but I also rear chicken. I have 550. And I go physically in the morning, 5 in the morning. It's me who puts the feeds, and then the children and the maids will do the drinkers. So I go to office. So we are no more stop saying that we are going to die at 18, we are going to die. No, my parents left me. So kindly educate those children, give them all the support, just follow the doctor's instructions. God will give you very good life. I take 10 years without getting pain, and I have no complication. But I have the same sickle cell disease that your children have.
This is to show the children that there is hope.
You are watching the DOCtalk show. This message is from the Ministry of Health with support from partners. You are watching the DOCtalk show. This message is from the Ministry of Health with support from partners.
Welcome back to the DOCtalk show. My name is Dr. Kamala Ivan. This show is sponsored by the Ministry of Health and Kamala Men's Collection. As we mark World Sickle Cell Day on June 19th, we are shedding light on sickle cell disease. And joining us now is Okello Emmanuel, who is at the forefront of Gulu Sickle Cell Marathon. Welcome, Emmanuel.
Thank you so much for having me on the show today. My name is Okello Emmanuel. I work with We Incorporated. We are a public relations. We do communications, and we also run the Gulu Corporate Gala. And this year, Gulu Corporate Gala has partnered with Gulu Regional Referral Hospital to conduct the Gulu Sickle Cell Marathon to create awareness around sickle cell, as well as raise finances to buy the HB electrophoresis machine for Gulu Regional Referral Hospital.
Oh, thank you. That's a good initiative. And you said it was inspired by the desire to buy the hemoglobin electrophoresis machine for the hospital, which raises concern, like we had been talking about. Diagnosing the disease has not been easy in the past. So I think that was a good point of inspiration.
The marathon, Uganda has the 5th highest sickle cell burden in Africa, with 13.3% of children having sickle cell disease, and between 5,000 to 20,000 children are born with sickle cell, of which 80% of them die before reaching 5 years. And the prevalence of sickle cell in Uganda ranges, with the actually sub-region having a prevalence of about 20%, which is the highest in the country, just second to Arua. And with this background, we thought it wise to get involved to, one, sensitize the community about sickle cell disease, as well as get involved in actually an activity that can help in combating sickle cell, because part of the problem that we have is the access to accurate testing services, which is why we have quite, the prevalence at about 20%. So we feel that with the initiative that we have come up with to do the Gulu Sickle Cell Marathon this year, we shall be able to create the necessary awareness that we believe the community needs to, be sensitized about. We also believe that we shall raise some resources that can enable us buy this machine for the hospital. So that is basically what inspires us and the background that we come from in doing what we're doing this year.
Yes, I think this is a brilliant initiative on the side of diagnostics, which has been a challenge so far. People not having a place to actually test, to get tested. And I'm just curious, will people be able also to test to see if they are carriers?
Yes, we have reached out to quite a number of partners who we believe will work with us for the period that we shall be doing the Sickle Cell Marathon. Normally, as Gulu Corporate Gala, we normally have football outings every first Sunday of the month at Gulu University Playgrounds, where we have the corporate community of Gulu, right from civil society, banks, businesses. We normally come together once a month. So as part of the awareness and then the much needed need for people to have access to testing, through some of our partners, we shall be conducting free sickle cell testing services leading up to the actual marathon that we shall have on 27th of September 2025.
What message do you want the participants and the wider public, would you want them to pick from the whole event?
We want people to be aware. People are not aware that they are actual carriers simply because I think they lack the knowledge and the understanding. Especially in northern Uganda with Acholi and Lango sub-region, there is the prevalence of sickle cell in Lango, it's in Aleptong, and then in Acholi, there are some areas where, in Acholi and Lango sub-region, there are some areas where people marry within their clans, people marry relatives, so which makes it very hard for people to, fight sickle cell because they are not aware that they are carriers. So the whole intention is we want people to have access to testing. People before they are getting married, people need to know that they should take some of these tests to know their sickle cell status as a way of fighting this disease long term. That is our main agenda.
Okay, thank you so much, Emmanuel, for joining us. This is a great initiative. So Dr. Henry, maybe you may have some questions for Emmanuel.
Okay, thank you very much. And thank you very much, Emma, for the wonderful work that you're doing. Yes, much as we in the hospital setting, we see these patients and we try to treat them and diagnose them, but I noticed that there is that component of the community engagement that has always been lacking. And so when initiatives like this come through to put this work out there in the community, raise the awareness, put a campaign like the one you're on right now to buy an HB electrophoresis machine, I really feel that's a very, very great work. For quite some time, even at the level of the national referral, we didn't even have that machine. But now that the machine is there and you're also going to start these campaigns that could result into regional referrals like Gulu getting an HB electrophoresis machine, I feel it's a right step in the right direction. So I just want to encourage you to continue doing this, engage as many people as you can, the religious leaders, the key influential people in the communities, and the community itself, so that we raise the awareness, and together I believe we shall be able to fight against this sickle cell disease. But maybe my question to you will be, what does it take for somebody to participate in such a marathon?
Thank you so much for that. We have kits, and our kits are going for as low as 35,000 shillings. And we're also open to partners and organizations that see that what we're trying to do does make sense to them. We are open, and our social media pages shall be on from 19th of June, when we officially launch on International Sickle Cell Day. So we have kits going for 35,000 shillings, and our sponsorships. We also welcome sponsors on board to work with us on this, because we cannot do it alone. We really need people who can push us to enable us, get this done. Shally.
Okay.
Yeah.
Awesome. Thank you very much for that. So maybe my other last one. So it's going to be in Gulu for now, or you're going to do the whole region? I don't know. So will it be the people in Gulu, or you planning to do maybe even different districts away from Gulu?
And for now, we're doing in Gulu. Okay. We're going in Gulu because much of the work is in Gulu, and that is where we're doing that, because the intention is for the entire northern Uganda and the Chole sub-region to know that sickle cell disease is a serious challenge, and but it's a challenge that once we work together collectively, we can always have some actual work done. That's why we believe the awareness on some of the radio stations. And then today we have been so fortunate that the Doc Show has hosted us, which gives us that national visibility that we need. And but most importantly, Ugandans should be aware that sickle cell disease is a serious disease, that people who are getting married should take it seriously and go to the hospitals and get to know their status, because most times a number of people, especially young couples, they just get into a relationship and they start having children, and unfortunately for the case of Gulu, we have had people give birth and they end up leaving the children in the hospital simply because they were not aware, and they decide to just be irresponsible about the matter. But some of these things can be avoided by doing the test that they need to do. That is why we believe having this machine at Gulu Regional Referral Hospital shall enable us at least take a step, positively in combating sickle cell in the region.
Thank you, Emmanuel. As we wind up, we are talking about sickle cell disease. June 19th is Sickle Cell Disease Day, and we are joining the rest of the world in creating awareness. So Emmanuel is one of the focal people at the forefront of the Gulu Sickle Cell Marathon, which is an initiative that has been designed to increase awareness about sickle cell disease in Uganda, and especially in the northern region, Gulu region, and also to advocate, to get sponsors, and also they are taking a step to be able to be diagnosed and to take action. Like Henry said, this one is important, and we've been trying to promote it, and now finally steps are being taken where we ask people to screen for sickle cell disease, to get screened for sickle cell disease, just like you get screened for HIV and other illnesses. So this, thank you, Emmanuel.
Thank you so much.
Thank you, Henry. So this has been a very interesting conversation. So parting shots, we're going to take some parting shots right now. And I'll start with Henry and then Emmanuel.
Yes, thank you very much. So sickle cell is here with us, and it's incumbent upon all of us to put our energies together to combat it. Premarital counseling is there, premarital testing and screening is there. So I encourage you all to please go for this screening. And if you're positive and if you want to be a carrier, you can always be cancelled on what can be done next. And maybe also want to encourage our people, especially in northern Uganda, to be part of this Gulu Marathon. I believe you can all contribute to this fight, not only in Gulu, but the whole country, because this is a national program. Thank you very much.
Thank you so much, Dr. Kamala. I'm just urging all the viewers of the DOCtalk show to support us. You can donate some monies. You can reach us through the Doc show and donate some monies. You can sponsor the Gulu Sickle Cell Marathon and support the sickle cell fight in Gulu. Thank you.
Thank you, Emmanuel. As we wind up this show, this episode was about sickle cell disease. June 19th marks World Sickle Cell Day, and we are adding our voices to the rest of the world, shedding light on sickle cell disease. our call to you is to join the forces to create awareness and join the marathon. Participate in any way that you can. You can participate by contributing. You can participate by actually participating in the marathon, and we increase awareness about sickle cell disease. Sickle cell disease is a disease that affects many people, and we cannot end without mentioning the resilience of these individuals that have sickle cell disease. This day and this episode is to honor these individuals, their resilience and their effort at life. They are very, very strong individuals, most of us who have met them. They are very strong individuals. They go through a lot of, they are constantly in pain. They go through difficult lives, but they are extremely positive about it, and many of them deal with it positively and very well. So thank you for tuning in to the DOCtalk show for this episode on sickle cell disease. And as we mark Sickle Cell Awareness Day on June 19th, we would like all of you to honor the people with sickle cell disease and honor their resilience, and join us as we create awareness. Thank you for tuning into the DOCtalk show, and see you next time on the DOCtalk show.
This message is from the Ministry of Health with support from partners.